information or share it with any of your colleagues who might be interested in the presentations we have today. And if you could please just mute yourselves until it's time for you to either present, or after each presentation, we'll have time for questions and answers. And then at the end of the meeting, we'll open it up to everyone to share about your organization. If you have any information you want to share, it's your opportunity to network. Whatever you have in the works coming up that you would like to share with everybody, that will be your opportunity to do so. Okay. So does everybody see the agenda? Okay. Okay, so thank you everyone for taking time out of your schedules to join us for our February Indiana Recovery Network meeting. We are going to have a couple changes to the agenda as it is right now. So we will be first having a presentation, if they're here, from Aspen. And then we'll have a presentation from Overdose Lifeline, followed by a presentation from Meridian Addictions and Recovery Center. And then if time allows, we'll open it up to everyone to share information about your organizations, the services you provide, and all those good things. So I'm going to stop sharing. And then do we have Aspen here yet? Sorry, I'm just looking.
I don't see them, Heather.
Okay. All right, then we will just start off then with Overdose Lifeline. So Justin, if you're ready, go ahead.
Okay, one sec. Good morning / almost afternoon. I feel like I might be speaking to the choir a tiny bit here. So forgive me for any redundancy for those of you who already know everything I'm going to share. And I'm trying to do my technology, so bear with me. Now, do you just see the slide and not the, okay.
Yes.
Yay. All right, good morning, afternoon. I'm Justin Phillips from Overdose Lifeline. And thank you, Heather, for allowing us to come today. It's good timing because a couple of things that I really want to talk about. I think all of you in this meeting and the organizations that you represent and or your affiliation with the Indiana Recovery Network can really help us with a couple of our programs where we are constantly, hoping to reach into the community in ways that we don't already get to. So quickly, as a reminder, we've been in existence since 2014, so hard to believe it's been that much time, but of course, for those of you who have been doing this work that long, I know that we've made some significant impact on the way that we address substance use disorder in our state, and the resources that are provided in our state are exponentially so much better than they were in 2014. So I'm grateful to all of you for the work that you do to contribute to that. We do work with each county in Indiana in a variety of capacities, and we also have relationships with almost every state in the country. The main things that we do, we try to put into these 3 buckets. So I won't be talking about all of them today because I have a short amount of time, and you guys already know I tried to pick the things that I felt were most relevant to relationships. But we do have online continuing education units that come out of Purdue, and they can either be done individually or in a 20-hour certificate. 6 of those 8 courses meet the Federal MATE Act. For those of you that don't know, is a federal requirement for physicians. We have prevention education programs for youth that I'll touch on briefly. We do a lot in the naloxone area. Most of you know, I'll go into more detail about that. We've been working to directly address Black overdose deaths and the disproportionate number of people in that community that have overdosed, and that number is down, which is really great. And then we have our support programs, most of which I'm going to talk about in detail because I think they they are good for this group to understand. So just as a reminder, we have this law, and some people don't know. I think all of us do know, but I decided to leave this slide in because there's still people who don't know that we have this law that's 10 years old this year, which again is crazy, that allows us to have access to naloxone over the counter without a prescription. So while you can get Narcan, the brand, at CVS over the counter now, it's really no different than you can get any overdose reversal agent without a prescription through a variety of distribution entities that are registered with the Department of Health. And I'll talk about that a tiny bit. So these numbers are a little low, to be honest. We do have over 650 nalox boxes now, 17 vending machines, and 200 plus naloxone distributors. So what that means is we have this great partnership with the state of Indiana and the Division of Mental Health and Addiction to provide naloxone. And I call it naloxone because we currently don't distribute the brand Narcan because we have a better price on the generic version. We are able to distribute naloxone free. Some of you may serve as a distribution partner. We certainly couldn't do any of the great work that we do with access to naloxone without our distribution partners and our Naloxbox partners. So if you don't know what that is, or if you're interested in learning more, you can get in touch with us. We have a link at the very top of our website where you can find naloxone near you. So you can refer anyone that you know might be in need to this website. You'll see that there's a map. This map indicates all the places someone can go, either to meet with a one-on-one person as a distribution partner, or where a nalox box might be, or where a vending machine might be. Those things are all marked. FTS is also marked because not all nalox boxes have fentanyl test strips. But all of these places, the nalox boxes, allow a person to have access to overdose reversal agents 24 hours a day, 7 days a week, without having to interact with a human, which sometimes still is a challenge. People still find, have their own personal shame about needing this. And so this is the beauty of this partnership and this work that we get to do. We distribute 24,000 doses approximately a month across the state, which is tremendous. And we collect overdose reversals. We don't get as many as we wish we would, but we do try to get those anonymously. And our system allows you to just say that you use the dose, and that's all you have to say. So we're pretty happy about that. We do our best to have few barriers as possible while still being able to report back to the state and be a good steward of the resources. We also have a school naloxone project for those of you that might not know. This is really to target the school health personnel to help them understand. Sometimes they are the first line of defense for a student that may be experiencing an overdose. There's still a lot of resistance from school systems, but through this program that has been funded by the CareSource Foundation, we developed a training specifically to speak to the school health personnel and the school resource officers. And we have been able to get quite a few school districts trained and get them to understand the need to have naloxone on campus. We sometimes have to use the backdoor approach, which is that you may have somebody on your campus that's a visitor that may suffer an overdose, which is still very true and relevant. But unfortunately, we've had some students overdosing in schools, and we've had some students, thinking that they're getting an Adderall from their friend or however, that has really turned out to be a fake pill with fentanyl test strips. So it's important that everyone, is prepared as much as possible. As I mentioned, we have youth prevention programs. So we have sort of three buckets of youth prevention, two being the school programs that we have. This is not about drugs, which is our proprietary program that we've been using since 2015. It is very opioid specific, universal program. So really anyone can benefit from its message. And we do that in Indiana schools, and we do that in lots of other states in the country. We recently, we're in the middle of piloting a new program called Perspectives, which is an online self-directed for the students, for the teachers to assign. It goes into a little more detail than This is Not About Drugs, around other substances of use, and to include more resiliency tools and alternative methods to substance as a solution. So that will be available after it goes through the piloting phase and the evaluation process that we're doing. If anyone's interested, please get in touch. We have 2 locations in Indiana piloting, but we'd always be interested in another. Preventure is an evidence-based brief intervention. It's considered a brief intervention because of the tiers of prevention programming. It falls into the brief intervention sphere, but it is, as I said, evidence-based and really, honestly, a remarkable, easy to implement program that has tremendous efficacy. Most recently, journal article in the American Journal of Psychiatry with new results from a new study. And we can train others to deliver prevention. And we do have quite a few partners in Indiana implementing prevention. And then finally, we have our Aaron's Place programs, which I'll go into more detail on another slide. So this would be one of the programs that I really want you all to know about and to keep in your Rolodex when you're working with families who you know are affected by substance use disorder, because I know that there's a lot more kids out there that could benefit from Camp Mariposa. It is for children 9 to 12 who have a family member, and it could be a grandfather. It doesn't have to be mom or dad or brother or sister who has substance use disorder. The child has to have an awareness of the substance use disorder because we regularly speak about addiction. It is a free program. It's not a traditional camp by its name. That's the name that comes with the program that we are a part of, a network out of the Aluna Foundation. We overnight with these children every other month. So we're actually camping this weekend. And it's, as I mentioned already, it's free. We have a clinical director and we have clinical mentors. So we do serious therapeutic intervention with these kids around that this is not your fault. And we give them a ton of resiliency tools. We use trauma-informed TBRI, which is a certification our clinical director has. And we have mentors. It's a mentoring program really also. And we do that, as I mentioned, every other month. But then we also have family activities on the months that we're not at camp to help transfer over the skills that are learned at camp within the family, because, you know, oftentimes the family also needs some skills and tools. We do this in 2 separate locations. So we have Indianapolis and we have Southern Indiana, which is in Mitchell. And we really could use some referrals. We're rolling into our 5th year, which is hard to believe. And we had kids graduate last year. So this is, you know, people don't really want to talk about substance use disorder in their family. People don't really want to acknowledge. So it's a little bit of a challenge, but some of you are working with families who already are willing to acknowledge. So please, if you're interested, I'll put my email in the chat when we're done and I can direct you to that application and that kind of stuff. We provide transportation stipends. So we do have campers that come as far as Terre Haute sometimes. So there's a lot of variety, and it doesn't have to be that you live in Indianapolis or that you live in the Mitchell area. And then secondly, we have a community catalyst grant from the Division of Mental Health and Addiction to work with teens, very hard population to work with, hard to get them to engage. But we're making an impact finally with a good core group of kids, and we do this online as well as in person. So we do a little bit of both to try to meet them where they are. But again, if you have some kids within this age range, we welcome their referral. We have, I don't know how I'm doing on time, Heather. I'm not paying attention, but hopefully I'm okay. We have a recovery house for women, which is based in Indianapolis. But again, we have residents come, from wherever they need to come. We serve a specific niche population, which is pregnant and or parenting women with children under the age of 4. And so we have a lot of involvement with DCS, typically because the women that we serve often have open cases. The women have lots of postpartum and lots of trauma, so we have an on-site clinical person who addresses that directly. We do lots of parenting. We attend family case meetings with DCS. We're really trying to eliminate the involvement of DCS in these families and save taxpayers some dollars by helping the family stay unified. For anyone that's ever been in recovery and also had children, it's hard to find a way to do that without having to make sacrifices. And so we tried to make this a place where women could get a really solid foundation after some inpatient detoxification before they actually have to venture out on their own, because parenting in and of itself is a big challenge. So we do subsidize their early stay in the house through Recovery Works and some funding through SOAR. We don't want anyone to have to come with any money in their pocket before they get on their feet. So we try really hard to do that. It's a complicated population to serve, but it's very rewarding. In the 2 years, a little over 2 years that we've actually been actively having women in the house, we've had no one return to use in our care, which I think is amazing. We've had people not be able to stay because of behavior, because people don't want to follow rules, how we are as humans, but we've had no one return to use, and we have quite a few graduates who are successfully staying sober and doing the deal. We have a program called Lifeline for Loss, which is a monthly support group for people who've lost. So this is really important. You guys all know that community is so important in any journey that's challenging, to include recovery, but also grief, especially as it relates to losing a child. Particularly, it's out of the norm of how we're supposed to lose people in our life, but anyone is welcome to join. We do this once a month, as I said, on the third Monday of every month here in Indianapolis. I wish it were virtual, and maybe someday that's something we can accomplish. But then we started this peer grief support program. So similar to what some of you all do as it relates to peer recovery, right? So we know how valuable a peer is in a recovery journey. So it's also valuable to have a peer in a grief journey. And so we've partnered with the Marion County Coroner's Office and the Marion County Public Health Department to run this program called Peer Grief Helpers. And so again, if you know someone who could use this, it's the same concept as recovery coach, right? It's just someone, especially in those early days, that's just there to hold your hand and say, yep, this is really normal. Yep, I've been through this too. This is maybe how I handled the question of how many children you have, or whatever those complicated things are that you don't really know how to navigate. And then it becomes a warm handoff to Lifeline for Loss, but also this person remains available. And we get referrals from the coroner's office, but we can always take outside referrals. We train peer grief helpers. They have to have lived experience. We just had a training earlier this year, and we'll probably do another training. So if you know someone who's far along enough in their journey to serve in this role, please do let us know about that as well. And then I believe this is my second to last slide. Just as an awareness, for those of you that don't know, we always have Overdose Awareness Day. We've been doing this now since 2014 as well. It's an internationally celebrated day that always occurs on August 31st internationally, but we always try to do it the Sunday before because you never know what day the 31st is going to fall on. We have been lucky enough to have it at the Indiana State Museum, TBD for this year, but hopefully that still will remain. It's free. It's merely just an opportunity for people to come and honor their loved one, and have a nice meal and have a different way of community as well. We always also put these ribbons in our yard here at our office on Michigan Street, which is it. And that's just, we do a ribbon for every death in the calendar year nationally. So typically there's around 300 or so. And that's just an awareness for people driving by, hey, we're here. Let's not forget these lives that we've lost to overdose. Yep. And here's my email. And hopefully you learned something you didn't already know, or you'll remember some of those things that we can partner on together. And I appreciate the opportunity to be here today.
Thank you, Justin, for sharing. I definitely learned something new about the prevention work that you all are doing. So thank you for sharing that. That's really good to know. Does anyone have any questions for Justin? Right. Well, in the chat, Rebecca did put an updated agenda as well as an updated contact list for the presenters today. So feel free to follow up with Justin if you'd like to get more information about all the great work and the many services they are providing around the state of Indiana. All right. Erica, if you're ready, you are up next.
All right, let me see if I can start sharing. Okay, can everybody see my screen? Okay, great. I see some familiar faces there in the meeting. Hello to you that I know. It's good to see your faces. So my name is Erica Allen. I'm the operations coordinator for Meridian's Addiction and Recovery Center here in West Lafayette. And I'm going to tell you a little bit about our program. So, in order for patients to come into our program, we start with a pre-screen. It's a 20-minute conversation. It can be done over the phone or in person. We prefer over the phone. It's just easier for the patients typically, but we do have people that just show up. And so the phone number is listed there for anyone that's interested in completing a pre-screen. That phone is manned Monday through Friday, 8 to 5, and there is a voicemail. So in the event that, the people answering the phone are on another call, we do encourage everyone to leave a message because every message will get a return phone call within those business hours. We are looking to expand our admission hours to 24 hours a day, 7 days a week. That just takes some extra staffing that we are trying to gather along with the rest of the state, trying to gather more staff. So the contact number is there. That is to do the pre-screen. Like I said, it's only about a 20-minute conversation just to kind of get the gist of what's going on with the person calling. Anybody can call. A lot of times we have family members call and say, hey, can you call my brother at this number? He asked me to help him find placement, right? So that happens regularly. Probation officers call. Social workers from hospitals and nurses from hospitals will call. The patients call themselves. And they'll call from prison and jail a lot of times as well. So we take anywhere and everywhere the patient might be, including at the homeless shelter using the phone on the counter there. So we take it from all angles there. So you complete the pre-screen. Sometimes we say, expect possible delays just due to normal operations that come up because we are a small team here. And so we pitch in on the unit to help out with patients also. In urgent situations where you have somebody, we all know when somebody decides they want to go into treatment, we need to act right then because that can change quickly. So in urgent situations, my cell phone number is listed there. That's my work cell. I can complete like a pre-intake over the phone just to see, if we would be the appropriate level of care. Just with a few questions there. And then if we are not, we always help them get into the other level of care that they would need. So currently, we are able to admit patients Monday through Friday. That says Thursday, but it's Monday through Friday, 8 to 2 p.m. The 2 p.m. cutoff is due to our availability to get medications for the patients because we utilize an outside pharmacy, and they're only able to get us meds within a certain amount of time. We are expanding that beginning next week, where we will be able to take admissions up until 4 p.m. That allows for the admissions staff to still be able to work their normal hours and go home by 5. So admissions will be 8 to 4 as of next week. That Friday before noon no longer applies either. We did get another provider, so we're able to expand that. Exceptions can be made in some cases, depending on what's going on with the patient. If they have any medical issues that they would need medications for that we aren't able to get them by a certain time. So we always say just reach out to Erica, myself, directly if there's a special exception that needs to be made, and we'll see what we can do to make it work. So the admission criteria, given the level of care that we have, so we are an ASAM 3.5 program. So when we are screening those patients over the phone, we're using the ASAM dimensions. So typically our typical patient is in active use. So that means they're using all the way up until the day of admission. Excludes patients that are abusing benzodiazepines or alcohol, because those withdrawal symptoms can, be deadly, as we all know. So we recommend them to go to a medical detox first because our level of care doesn't allow us to have like Ativan and Librium to bring them down slowly. So we typically it's the same day of use, but we do have within the last, 3 to 5 days, we need them to have use of their substance. If they're incarcerated, that up to 1 week doesn't apply. So we have patients that call that have been in jail for 18 months, so they haven't used in 18 months, and this is a condition of their release, and so they're able to come directly to us without having used in 18 months, but it's a step down from being incarcerated. So the patients that we do have, just as a caveat, that do end up going into medical detox, we do have to have them in a secure transport from that detox program to us, just to avoid contaminating the urine drug screens when they get here, because they will be positive for benzos when they come in, right? If they did an alcohol or benzo detox somewhere. So we just need to be sure that that positive is from their withdrawal medication. So it has to be a secure transport. Our insurance requirements are pretty open. Just like everywhere else, we can't take Medicare for substance use treatment. There are a couple different kinds of Medicaid that don't cover it, the QMB, the family planning, and the emergency services. We have plenty of patients that don't have any insurance at all. When they come in, we'll try to get them signed up for that presumptive eligibility. And if they don't meet those requirements, we are a nonprofit. And so we will have them sign a paperwork saying, this is going to be the agreement for what the total could be at the end of the stay. But it is a sliding fee scale based off of income. And then Meridian will contact them post-discharge to set up a payment plan that can be anywhere from like $5 a month to whatever they're able to do. Like I said, we are a nonprofit, so. Some of the medication restrictions, we have patients that come in obviously prescribed medications normally. And so the ASAM 3.5 level of care doesn't allow us to have different types of medications because we don't have 24-hour nursing. So anyone that is on a blood thinner, that's typically a medication that we can't take just due to the risk of blood loss if they were to have an injury. The sleep aids, such as like Ambien, those are things that can be abused, so we can't have those. Benzodiazepines, the stimulant ADHD medications, Any pain medications or muscle relaxers, we're not able to have either. And then if there's anybody that is on like Depakote, or those kinds of things that require those regular lab draws, we want them to be stable on whatever that medication is for 2 weeks coming in so that we don't have a risk of them, having an adverse reaction. We do offer medically assisted treatment here. So that is something new within the last year, I believe, for us. So patients can come in on Suboxone and Vivitrol. Methadone is the only one we do not have here. So they can come in on those, as well as while they're with us, they can get started on them, and then we can provide the follow-up care as well. If somebody does come in on Suboxone, just because we do use an outside pharmacy and sometimes they have difficulty getting us our medication same day, we ask that they bring a week's worth of their Suboxone with them just so they don't go without in the instance that we don't get that delivery. Our programming is pretty robust and jam-packed. So we do have 12 hours of scheduled programming 7 days a week. Now, when we say 12 hours, that does include, wake up and hygiene and med pass, and then all the way down to like lights out. So it's a very robust program with a licensed social worker, certified peer recovery specialist. We have skill builders, registered nurses, and medical assistants as well. So they receive that programming at different groups from all those different staff. We have a high focus on discharge planning and aftercare resources because that is the most important, right? We don't want them to return right back to that environment that they came to us from without any changes being implemented. So a lot of the patients that we get are homeless and don't have housing. So that is, the number one criteria when they come in is, okay, what community do you want to be in? Are you on probation? Are you allowed to leave the county? So we start looking for sober living housing and different things that might meet their needs. And then we'll follow that up with wherever they, decide to have their residence with the resources in that community and get them connected. So they have, by the time they leave, they have all of their appointments are set up and ready, and they're provided, they've made those appointments while they're with us. They've had that hand in that discharge planning. And so then they have their list there of like, okay, I know tomorrow, I'm going to the primary care to have my first intake there. So they have all of that ready. And then they're able to also reach back out to us. We encourage all of our patients to stay in contact with us. We do have a Caring Contacts program where we reach out to them at 7 days post-discharge, 30, 60, and 90 days. So we have those 4 established calls that we make just to touch base with them and see how are you doing? Did you lose your discharge plan? Do you need me to pull it up and tell you when your appointment is again? Check in with them and see how they are recovering because sometimes they need to return and so we're able to provide that safety net and catch them sometimes before they reach out for help and bring them back in. And then our average stay is typically 21 days. It is based off of the patient's needs. So sometimes it's longer, and sometimes it's shorter. Sometimes there's patients that have had, 2 years in sobriety and they had a lapse and only used for a few days, but they need to come back in and kind of reset. And sometimes that can be a week or 2 stay to get them reset and ready to get back into the community. And that is all I have for that. Are there any questions?
Thank you, Erica, for sharing. Anyone have any questions for Erica? Looks like we're a small but mighty group today. Go ahead, Jacob.
Yeah, so hey, Erica. It's good to see you.
Yeah.
I think that's amazing that you can take people coming from incarceration after 18 months. I know in my personal, sorry, my cat is trying to
We love cats. It's fine.
Yep. But I would have been released from jail to a treatment center, but couldn't find a treatment center that would take me because I wasn't testing positive for substances anymore. And
Right.
so I just want to thank you for that and for me now knowing that because it's something that can be such a barrier.
Yeah, the risk of overdose when somebody's released from incarceration is huge, right? Because they don't have that tolerance built up anymore. And so being able to step them down from such a restricted environment, step them down to like the residential and then sober living with a PHP or an IOP. Like that's real ideal. We would love to be able to build that relationship with our local jail to have that just kind of be a streamlined process that's just the normal protocol. We're still working on that, but we have started a relationship that's really great there. Hi, Tammy, by the way. Tammy used to be one of our peers here, and then she went off to travel the world and do amazing things.
Good to see
I
you.
know.
You look great. Your hair has grown immensely.
It has. Any other questions or anything I can help you guys with?
Hi, Erica. This is Diane Buxton with PAL, Parents of Addicted Loved Ones. Is there a dual diagnosis there also? I mean, do you treat those with dual diagnosis?
We do, yeah. So the 12 hours of programming throughout the day, they have individual therapy with our licensed social worker, and then one of the groups that is provided that we're getting ready to, I think, span that to 2 groups a day by the therapist. So they have group therapy as well. And so the dual diagnosis, we can take most mental health symptoms and diagnoses. If we have a patient slipping into psychosis where they're not really reality based, and they're not able to process what's happening, or if we have somebody that slips into suicidal or homicidal ideation, at that point we would do a referral over to the psychiatric unit and get them over there for a few days to get stabilized on some things, and then they send them right back to us.
Great. Thank you so much.
Of course.
I just want to add that psychiatric unit is in the same building,
Across the hallway.
which is really helpful.
Mm-hmm.
All right. Anyone else have any questions for Erica?
I just want to thank Heather and Rebecca for the opportunity to present today and connect with you guys. Justin, I absolutely loved your presentation. I learned a whole lot, and I'm going to be reaching out to you soon for some things. Thank you for presenting.
Yes, and if you all haven't already, feel free to send your slides to Rebecca, and then we can share that with the group too. Okay, well, we have plenty of time. Y'all did a great job on your presentations, and since 2 presenters were unable to attend, we have lots of time. If anyone wants to share anything about your organizations, what you have in the works, if you have any events coming up, or any of the things. So if you want to share, just raise your virtual hand, unmute yourself. So your name, your organization, where you're located, and then how can people contact you once you've shared your information. So go ahead. We have Mercy up first.
Thank you so much. Hey guys, I really appreciate being in this space as always. Sorry, we're just having so much fun over here. Somebody almost made me laugh on camera. But I wanted to come in. Mercy has had the opportunity of having 2 cohorts of antidotes, which is our youth program. Mercy is Minority Recovery Collective, Inc. We are an organization here in Indianapolis, Indiana, but we serve, all over, both physically and hybrid. We are a recovery-based organization. With the antidotes, that is our youth group. They are anywhere between 12 to 29. We've had the joy of having 2 cohorts over these last 2 years that were sponsored by the IAAQLI, and we're about to head into our 3rd cohort. So we're so excited about them being trained. And in this experience, I always want them to have a little bit more. So I wanted to ask everybody, or if anybody on this call is interested in coming in on the 3rd cohort on any of the days during the summer into the fall, to give information about your organization, what you do. We definitely wanted to make sure we're creating a path for more youth to take our spaces. I know one day I don't want to necessarily be in this space. I want somebody else to take it over and keep it going. So if anybody on this call would like to participate in the training portion and, speaking about what you're doing, we would love to have you. I'm going to make sure I put my email in the chat. Or if you would like to join in their 2nd season of their podcast, Melanated Mindfulness, I also put that in the email. Just let me know that if you want to join in, and we can be very flexible on you coming in to us doing a podcast, or you doing your recording from where you're at, and us including it in there. So that's our stuff. That's what we got going on, and we have a lot more events coming up, and I'll make sure to share those flyers with you. Appreciate you.
Awesome. Thanks for sharing. And yeah, feel free to drop whatever you want in the chat, your contact information, flyers, or you can send the flyers to Rebecca and then she can make sure they go out to the group and that we get those events on the website if they're not there already. Sorry, y'all, my brain's a little foggy. I'm struggling with some kind of bug, so I'm stumbling, but bear with me. Erica, did you want to share something?
Yeah, I forgot. I also am a co-chair for Tippecanoe Celebration of Recovery rally. So we have a rally every year, and we're looking to also start year-long events that we're able to participate in, where we are celebrating those that are in recovery and helping launch recovery for others. Our rally is in September, but we are looking for resource tables for the event where you can just kind of hang out for the day and say, here, this is what we do. It would be awesome to have anybody there who would like to be. If you are interested, just reach out to me via email and I'll be happy to get you included.
Thanks, Erica. Yeah, that's a fun event. We've attended that one a few times. So, okay, Jacob.
Hey, so we have our Leap into Recovery event going on here in Lafayette on Saturday. It starts at 1 p.m. It'll be at the Bauer Family Resource Center. In their gymnasium space, and we're really looking forward to that. It's open to everybody, so and all pathways of recovery as well. So we're not just keeping it locked down to one thing. Everybody's welcome to come. We're providing a free meal. We'll have a couple of recovery speakers that'll share about their journeys. We have a recovery band that'll be playing, and then we have, I think, 23 organizations that are signed up to set up tables for resources at the event. So that'll be really cool. Hope you guys can make it. And then I don't have a flyer yet from the Indianapolis Oxford House fundraising committee yet for their fourth annual Drag Me to Oxford House drag show. But it will be April 26th. Let me double check that date really quick. I'm pretty sure it's April 26th. It is. And so it'll be once again at Robert Parks Methodist Church I think it's on Delaware, downtown. But yeah, hope to see you guys at that. It's a blast every year. So, all right. Thanks.
Thank you, Jacob. All right. Anyone else want to share anything about your organization?
Yeah, so I work for Groups Recover Together. We are a medicated assisted recovery program dealing in Suboxone. We are pretty much virtually trying to work on going hybrid. Same day, I'm gonna put our number in the chat. It's really nice for those who have transportation barriers. They are required to go to one group a week to stay on their medication. They meet with a provider monthly. And we're all over the state.
All right. Thank you, Tammy.
You're welcome.
All righty. So if you haven't yet and you want to go ahead and put your information in the chat so folks can follow up with you. And yeah, so thank you everybody for attending the meeting this month. I know we had kind of a smaller turnout than usual. Who knows? I know I'm under the weather. A lot of people are, so who knows, right? But thank you all for being here. So our meeting next month will be on March 20th, same time, same link. If you would like to present and you are a registered member of the IRN, please reach out to myself or Rebecca and we'll get you added to an upcoming meeting on the agenda. And then as you all are having events or anything, please send them that way and we'll add those to our calendar. So stay warm, everybody, stay safe, and we'll see you in March.
Thanks, Heather.